Hello everyone, my name is Dora Cavallo-Medved and I am the director of the weSpark Health Institute. I'd like to thank the 100 Women Who Care and our colleague, Dr. Carlin Miller, for this nomination. The weSpark Health Institute is a unique partnership between the University of Windsor, St. Clair College, Windsor Regional Hospital, Hotel Dieu Grace Healthcare, and Erie Shores Healthcare. Collectively, our 5 partner institutions have come together with a shared vision and mission to improve the health of the community of Windsor, Essex, and doing that through transformative research. weSpark Health Institute is focused on 3 major areas of health: cancer, brain and behavioral health, and community health. We serve all of our health researchers across Windsor, Essex, over 250 core members, alongside with students and healthcare providers. Our community partnerships are important to us as we continue to come up with the solutions to the health problems across our region. Through weSpark, we serve everyone here in Windsor, Essex, from children to teenagers to young adults and seniors. Our research helps transform the health and improve the lives of everyone in our community. In fact, many studies across Canada have shown that people living in communities with active health research live longer and live healthier lives. This is what we are trying to do here in Windsor, Essex. We deserve it, just as any other community in our country. We have a small but mighty team of staff who are there to support our researchers by providing tools and resources, in addition to administering a grants program that helps elevate and bring forward those research projects that are going to transform our community. And it's through our grants program that we elevate those health research projects across Windsor, Essex. Our grants program, which is vital to supporting our health researchers and the health outcomes of our community, is supported by our partner institutions and also sponsored by many organizations across Windsor, Essex. This is at the core of weSpark, working collaboratively to bring forward health outcomes that will improve the lives of everyone in Windsor, Essex.
I'm a professor at St. Clair College in the Social Justice and Legal Studies program, but I'm also the coordinator of our local Violence Against Women Coordinating Committee. Our primary focus is on prevention, education, and advocacy in regards to intimate partner violence, so violence against women and their children. So within this committee, and in response to several femicides that occurred in Windsor, Essex over the last few years, we decided that we needed a different approach. So a lot of what we do is very frontline work, which is extremely important, but when we need systemic change, we need leader buy-in. So we developed what we called the leadership table, which brought together a subcommittee of executives and leaders across these different organizations. So one of the first gaps that this committee identified was specifically the need for shared foundational knowledge around intimate partner violence. And so this is what led to our project. But it's a self-guided training toolkit that draws from existing best practices as well as existing resources that are already out there and adds new locally tailored and developed materials, bringing everything together in one accessible space. So the weSpark grant made this possible. So it allowed us to integrate students, faculty, as well as community partners in a truly collaborative, as well as a co-creative process. So for a committee that's fairly funded, specifically talking about the coordinating committee, and it's really largely volunteer driven, the support meant that the work could actually get done. And it laid the foundation for something much bigger. So they went on to successfully secure a $2.5 million Ontario Stands grant with over 15 other partner agencies to launch the Hub Without Walls, or what we call the HWOW initiative. So this HWOW funding is expanding the reach of the weSpark work, including developing an evaluation and an implementation plan for the toolkit. So it's a full circle example of the ways that early research investment can really help to grow this large scale community driven change.
If we are fortunate to be selected today, we intend to use the funding to support 2 brand new IDEA grants specifically focused on women's health. As researchers and healthcare providers, we often hear the word hope. Hope you will feel better, hope your treatments go well, hope you can get back to normal life. But we know that hope requires deep meaning and commitment. And that comes through an action plan with solutions that is driven by transformative research.
It's really hard to deal with cancer patients day after day without having hope. And I think that's what the clinical research and clinical trials offers me as a doctor that I can offer to my patient. And then it lets me come back to work every day.
And so we leave you with a quote from one of our weSpark ambassadors, Dr. Michael Dufresne. Without research, hope is just a word. On behalf of weSpark and our team of health researchers across Windsor, Essex, thank you again for this amazing opportunity.